नमस्कार. आयचे गजालीचे कार्यावळीन आमचे बरोबर आसात तीन नामनेचे डॉक्टर्स जे आमचे खातीर ह्या खाशेले कार्यक्रमांत बेंगलोरच्यान आयल्यात. पयले आसात डॉक्टर राधेश्याम नायक, हेड मेडिकल ऑन्कॉलॉजी BMT. नमस्कार सर. तसेच आसात डॉक्टर बसंत महादेवप्पा, कन्सल्टंट लिव्हर ट्रान्सप्लांट सर्जरी. डॉक्टर नमस्कार.
नमस्ते.
आणि तिसरे आसात डॉक्टर जगन्नाथ दीक्षित, कन्सल्टंट सर्जिकल ऑन्कॉलॉजी. डॉक्टर नमस्कार. खरें म्हणजे अशें सांगप की ह्या एका कार्यक्रमाच्या निमतान अशे तीन नामनेचे डॉक्टर बरोबर मेळप हें सुद्दां एक भाग्य अशेंच म्हणूं येता. दिसान दीस मेडिकल विशयांतल्यो तंत्रगिन्यान बदलता, कन्सेप्ट बदलता आणि हाची जाणविकाय लोकां मेरेन पावोवपाची हो एक प्रामाणीक प्रयत्न. डॉक्टर, फर्स्ट आय वूड लायक टू नो what are the medical advances in colorectal cancer? Basically you can start with what you mean by colorectal cancer. लोकांच्या माहिती खातीर सांगता colorectal cancer म्हणजे व्हडले आतकडे जे असता किंवा जे संडासाची वाट असता ताचो जावपी कांकर, आणि हातून जे आज तंत्रगिन्यान बदलला, जे कन्सेप्ट बदलल्या, मेडिकल म्हणजे लायन ऑफ ट्रीटमेंट बदलल्या, ताचे विशीं आमकां वळख करून दितात डॉक्टर राधेश्याम नायक. Yes, sir.
It is cancer which comes in the whole of large intestine. At any part of large intestine it can happen. And it is related to lifestyle disease. It is a lifestyle disease, and as India is adopting Western lifestyle, the incidence of colorectal cancer is increasing, and that includes diet, lot of meat in the diet, animal fat in the diet, and lack of exercise,
and all junk food,
constipation. Those kind of things, and of course there is certain percentage, maybe about 10%, which is related to familial hereditary cancers. So this is how the thing is. And if I compare my own practice over the last maybe 20 years, I can see that what we started with was I think very low incidence of colorectal cancer, but now we are seeing large numbers of colorectal cancer. And on the other hand, we are seeing that stomach cancer, which was much more common earlier, is slightly reducing in incidence, because there is more of a Eastern lifestyle and this is more of a Western lifestyle related.
So just म्हणजे लोकांक कळचे खातीर सांगता की डॉक्टर म्हणटा की ही जी आमची जी पद्धती, जीवन पद्धती आशिल्ली, लायफस्टायल, ती आता बदलता हळूहळू, आणि आमी वेस्टर्न लायफस्टायल एडॉप्ट करता, आणि हाका लागून तांकां जावपी जी दुयेंसां आसा ती आता आमच्या लोकां मदीं चडशी दिसून आयल्यात, चड करून कोलोरेक्टल कॅन्सर. येस सर.
This is the incident. And as far as the advances which has taken place in colorectal cancer, one important advance I would say is the investigations which are available now. Flexible colonoscopy available, where we can look at the entire colon and take biopsies from wherever we want. We have got very nice imaging studies, including now PET scan, MRI, CT scans, which can tell us about the local disease, where all it has spread, and stage the disease properly, because the prognosis and treatment depends on the stage of the disease.
Correct.
So this is an advance which has taken place. There are a lot of molecular understanding of the cancer. We are looking at now genes and molecular events which happen in the cancer. For example, there is a gene which is mutated called KRAS gene, which is there in this NRAS. These are all genes which may be mutated in some cancers, not mutated in other cancers, and we place our we do our treatment depending on this mutation.
I see.
So from light microscopy we have gone deeper into the genetic studies in these kind of things.
So exact origin of the cancer.
Yeah,
and plus how to
two cancers may look alike and they may have same stage anatomically.
Correct.
But the behaviorally, biologically they are different.
Yeah.
So we are going into that levels now. So we can individualize the treatment.
Yeah. So
same disease,
tailor-made the treatment.
Yeah, tailor-make the treatment, and that increases the success and reduces the side effects to the treatment of the to the patient.
Yeah.
This is an advance. Of course, tremendous advance has taken place in surgery. Earlier, once the disease goes to the liver or only to the lung, we used to say that okay, this is incurable. Now surgeons are very aggressive. I think Dr. Basant will tell you that they can even operate liver, take out the secondaries, and some 25% of these patients can be cured also, even in the metastatic disease, unless it is a very widespread metastasis, in which case it is not possible. And a lot of newer advances which are still not into routine practice, but which we are looking at: vaccination therapy, immunotherapies, and a lot of 2-3 antibodies have been introduced there is an antibody called avastin, which blocks the blood flow to the tumor. It doesn't work on the tumor, but works on the blood flow of the tumor and then shrinks the tumor.
So indirectly the tumor cells die. Yeah.
And there is another biological drug called cetuximab, which acts on the receptor on the cancer cell only. It doesn't affect the normal cells.
I see.
So we now have what we call as targeted therapies, which target the cancer and spare the normal tissues or involve the normal tissues very minimally. In contrast to cytotoxic chemotherapy, which we used to have earlier, which indiscriminately hits at both. And we now have a combination where we can use cytotoxic and this antibody targeted therapy and have more success in controlling the cancer. So metastatic colorectal cancer, for example, few years before, say 10 years or 15 years before, people used to live for maybe 6 months or 9 months. Now patients easily live for 3 to 5 years. And some of them even go beyond that, 6-7 years with metastasis. And as I told, if it's a limited metastasis in the liver, 25% of them can still get cured with chemotherapy and surgery together. So tremendous advances have taken place, but to take advantage of these advances, we should diagnose them earlier so that they are cured, rather than later stage where we can keep them alive but at a great cost, because all these treatments are very expensive. And prevention, we know what lifestyle produces colorectal cancer. So we should try to prevent it by reducing weight, exercise more, eating more of vegetarian food, fruits and vegetables, and less meat. So those kind of things.
डॉक्टरांनी खूप महत्वाची माहिती सांगली. एक म्हणजे आमचा आहार बदलपाचो आणि दुसरे म्हणजे एक काळ आशिल्लो की आम्ही कॅन्सर म्हणजे सगळेजण गर्भगत जाताले, किमोथेरपी इतकी टॉक्सिक असताली की पीपल यूज टू प्रिफर टू डाय रादर दॅन टू लिव्ह विथ द ट्रीटमेंट. सो बट द डेज आर चेंजिंग. दोतोर सांगता की आज ही जी सगळी सिस्टम आसा ती बदलल्या, तरेतरेची वखदां आयल्यात की दे आर जस्ट म्हणजे त्या सेलाकूच टार्गेट करतात आणि त्याच खातीर ताचे योग्य वेळार निदान जावप खूप गरजेचें आसा. आणि योग्य वेळार निदान जाल्या उपरांत योग्य स्थळान ताची जर ट्रीटमेंट घेतली जाल्यार दीस इज ऑलमोस्ट म्हणजे यू कॅन से पेनलेस. मीन्स इट इज नॉट सो दिस थिंग बिकॉज एज अर्लियर द फुल कन्सेप्ट दिस इज आय प्रिफर टू डाय रादर दॅन टेक ट्रीटमेंट. दॅट कन्सेप्ट इज नो मोर रिमेनिंग. सो वी कॅन लिव्ह बेटर अँड इन द सेम स्पिरीट एज वी आर. करेक्ट. म्हाका दिसता हो एक अतिशय म्हत्वाचो कन्सेप्ट आसा जो लोकांनी समजून घेवपाचो. डॉक्टर बसंत, आय वूड लायक टू नो समथींग अबाउट लिवर ट्रान्सप्लांट, बिकॉज हियर द थिंग इज दॅट पीपल ऑल्सो से that it's very costly affair, only few people can afford, and then again they feel that it may not be successful. I would like you to throw light on this subject.
I'm Dr. Basant Mahadevappa. I want to concentrate my talk into two aspects. One is liver transplantation, and I also do surgeries of the liver and pancreas and the biliary system. So the second part is mainly oncology related, the first part is liver transplantation. In India, we do liver transplantations mainly for patients who are suffering from liver failure because of hepatitis B, alcohol induced, which is more and more, hepatitis C, and metabolic disorders. As of today, the rising trend is liver failure because of diabetes. So which is an unknown entity 10 years ago. People used to come with liver failure. They did not understand. They did not have hepatitis B. They never drank alcohol. They did not have hepatitis C. And still their liver used to fail. And now it is an increasing trend. The reason is diabetes, obesity. It's called a metabolic syndrome affecting the liver. What happens is the fat goes and gets accumulated in the liver cells and it destroys the liver cells. And slowly it goes to the next stage and ultimately cirrhosis. Not only that these livers fail, but also these livers have a very high tendency to have cancers. So the new guidelines that was released last year says any diabetic over the age of 45 years, they are supposed to get an ultrasound every 6 months. That is the chance that they can harbor a malignancy. So that is the latest guidelines. So these are the latest things that we are supposed to adopt in healthcare to make sure that patients suffer less in terms of going for liver transplantation. I mean, liver transplantation
Is
is
a last stage, like.
there is a procedure,
Yeah.
and we at HCG we have attained 100% success rate after I started the program over there.
Congratulations.
Thank you. So, but that is the last resort. What we have to look at is how to prevent the occurrence of liver. That is one thing.
Yeah.
So, as of today, if you have to prevent, one is take care of your diabetes, take care of your metabolic syndrome like obesity, diabetes. The second thing is vaccination for hepatitis B. And the third one is try to prevent alcohol. I mean, overdo, I mean, whatever you call it.
In
yeah.
Goa, at least we will have to take this with a pinch of salt, I should say. Because they have no guidelines to say what is overdo and what is underdo.
Right,
But
yes.
most of the people prefer to at least do it.
Exactly. No, but it compounds a diabetic patient having alcohol.
Yeah.
It actually
Exaggerates.
exaggerates the occurrence
Chances,
of
yeah,
both
okay.
cancer in the liver and also the failure of the liver, what we call as cirrhosis of liver. So, this is at the outset. I mean, how the incidence in liver transplantation per se, when the doctor says you need a liver transplantation, there is nothing else other than. Why we do liver transplantation? One is failure of liver. They feel water in the abdomen, they start forgetting things, they fall, and then they start bleeding, they start vomiting blood and all. So, in those are the main situations when a patient with a failed liver requires liver transplantation. The other reason is when there is early cancer in the liver. Usually cancer happens when the liver is damaged because of cirrhosis.
Yeah.
So, these are the indications for liver transplantation. Coming to the liver transplantation per se, it is a very safe procedure, but it has to be done the right way.
Correct.
There is no alternate to doing the right way.
And expert guidance.
I mean,
Expert hands, I should
expert
say.
hands.
Correct.
And also, there is no chance that you are going to take a chance on a patient because everything is laid down very straight.
Yeah.
All the tests which are supposed to be done have to be done. They cannot be bypassed. It is not like, okay, I'll go to the OT and then see whether it works or not. No, everything is already predetermined. Yes, when a patient comes with a very bad state, for example, he is very weak, he has suffered with liver failure for a long time, he becomes a high-risk candidate. But the thing is, these patients do really well after transplant because the liver starts working immediately in the operation theatre. And we have sent a patient home on day 3 after liver transplantation.
That's great.
So, this is where we have reached now. Yes, it is a costly affair for the fact that, the number of sutures that we place in a liver transplantation amounts to around 150 to 200. And each suture costs 1,000 rupees. So, you are already spending 1.5 to 2 lakhs. That is just about
Only for the suture.
only for the sutures.
Yeah.
And the clips we apply,
Yeah.
the amount of clips we apply, usually we use around 6 to 7, each costing around 17,000. So again 1.5 lakh. This is why it is a costly affair. I mean, people can think that, okay, doctors are making money. I mean, I did 17 years of training to become a transplant surgeon. So it is not about money. It is my passion, that's why I became a transplant surgeon. I could have become a medical oncologist.
So both of you have not made enough money as you feel.
no, nothing to do with money. No, this is purely not money. I mean, this is the last way to make money, being a doctor. I mean, it's a passion.
Medical oncologists also don't make much money.
So,
Okay, doctor, one more thing I would like to add, like plus the donor also will require the sutures and this thing clips.
yes, it's all included. I mean, we do it at a package of around 20 lakhs, which is amongst the cheapest that anybody is doing as of now in India. And we've got really good outcomes, and when we send patients on day 3,
It's really to be appreciated.
Yeah, and then the patients who are looking for liver transplantation get a confidence out of it.
Correct.
This patient has gone home in 3 days,
Yeah.
and the living donor patient has gone home in 5 days. I make them speak to them.
Correct.
They get the confidence, they get the zeal to go through the procedure.
Correct. Doctor, I have also a very simple question for you. Now the liver transplant